Mechanisms of Vasopressin by Hyla Torres. Our goal today is to take what we have learned so far about the urinary system and take on the mechanism of action for vasopressin. Hopefully you are all at least somewhat familiar with what vasopressin is, but we will still go over what it is, its derivation, how it functions in the body, and a real-life application. The urinary system, also known as the renal system, is much more complex than what we give it credit for. Initially, one may consider the intake of fluids and excreting waste. While this is true, it is important in this unit to remember the importance of maintaining homeostasis, as it is important to keep in mind for all units that we study. Today I primarily will focus on vasopressin. This hormone is so important for playing a role in maintaining water homeostasis. Here in the Arizona heat, we know how imperative this is during our long and dry summers. Likewise, it is just as important here as it is globally for all life forms. The water we take in is not just lost through urination, but also when sweating, breathing, defecating, and so on. If this is your first time learning about the urinary system, and vasopressin specifically, you will see how it is much more than drinking your water and later urinating. This hormone is a regulator to make sure we are keeping the right amount of fluids we need and excreting the rest. The urinary system works as a filter to eliminate urine and other fluid waste that the kidneys have excreted. The kidney produces urine, which will eventually travel through the ureters, which are tubes that transport the urine to an organ called the bladder, the water tank of the human body system. As the bladder fills, typically a person will feel the sensation of needing to relieve themselves and expel this waste. As simple as this all sounds, it will be your job as a medical professional to be knowledgeable of the types of injuries and infections that can occur in the renal system. Additionally, we will later learn what can be found from urinalysis, the method of learning more about a patient from a sample of their urine. You will be amazed at all you can see and discover from a few teaspoons of urine. Vasopressin is also known as the antidiuretic hormone, AVP, ADH, and even arginine vasopressin, so be prepared when you hear these other terms. Vasopressin is a peptide hormone made up of 9 amino acids. This hormone is created in the hypothalamus, which we know is a region in the base of the brain. The storage unit for this hormone is in the posterior region of the pituitary gland. Its primary function is to tell your body, and more specifically your kidneys, how much water being consumed needs to be retained and how much needs to be excreted. From the brain, the hormones itself will commute through the axons to make its way over to the pituitary gland so that it can reach the bloodstream. It also functions with the blood vessels of the body and the kidneys for part of the urinary system. With the kidneys specifically, it will aid in fluid retention and osmotic balance. It tries to reduce the amount of water released during urination. This specific function is in the kidneys. From here, water returns to the bloodstream and water loss is condensed. In the case that a person has too much vasopressin, they may be diagnosed with something called SIADH, which is a type of hyperammonemia, known as the syndrome of inappropriate antidiuretic hormone secretion. Being dehydrated or having a traumatic brain injury can be stimulated overproduction of ADH. These high levels of vasopressin in the system will encourage the kidneys to retain more water. This causes problems with the blood being overdiluted and further causing low sodium concentrates in the blood. On the other hand, if someone is not producing enough antidiuretic hormone, it will cause frequent urination by the kidneys excreting too much fluids. Overall, this will cause dehydration in a person as well as their blood pressure lowering immensely. In the collecting ducts and late distal tubule found within the nephron of a person's kidneys, ADH will be bound to the cells in this area. The hormone itself will be bound to the V receptor, which is hand in hand with G. This will lead to C-camp activation. Without the presence of ADH here, the collecting ducts of the kidney nephron would essentially be resistant to fluids, which would cause the water to be excreted out as urine, all of it. In the kidney tubules, there are types of channels called aquaporins, which have been named for being a reservoir of water here. ADH encourages the reabsorption of fluids here in the membranes. The channels not only hold, but also carry the water to rise osmolarity of the urine. The body is filled with receptors and osmotic sensors that regulate the amount of water in your blood since it is a constant give and take. These osmotic sensors not only work with water intake, but they actually search the blood fluid levels for specific molecules such as carbon dioxide, potassium, and sodium to ensure the right balance are being maintained. This is also a part of your body that regulates thirst. Our application for today. It's actually an interesting one to see how else vasopressin is used in our body. In recent years, vasopressin has been clinically studied in relation to its connection with those who are addicted to drugs and alcohol. Addiction is not an easy brain disease to combat and typically has a multitude of side effects related to its withdrawals. Vasopressin and its related receptors are part of the hormonal balance of a few body systems and do play a role in stress response seen with drug and alcohol addicts. We just mentioned vasopressin's relation to the urinary system, but as a hormone, it does even more, which even includes the regulation of stress response and related social behaviors which we know are distorted by drug and alcohol addicts. For example, there's still much to be studied about how the amphetamine cocaine affects the brain, vasopressin, and its related hormones and systems. The study further mentions the use of cocaine in animal studies, and it gave an increased aggressive behavior was observed. Giving the animals this amphetamine for a few days in a row proved delays in neurological behavior and vasopressin being released in the given areas of the brain. This study showed an increased amount of distress in the animals and anxiety-like responses. The study further highlights the relation of various drugs and alcohol and their relation and effects on vasopressin. Though those who consume these drugs are looking for a quick fix, whether that be as an upper or a downer, they don't know the short or long-term effects. Here in the classroom, we have the opportunity to read these studies that have been done, and hopefully more research will continue to be done. As a medical professional, it is so important to be able to recognize this in your patients. You never know who will be walking in or what their situation is like, so this knowledge is vital. Thank you for listening.